As a PA, I get asked a lot of pregnancy questions, but I really wanted to hear yours. So I opened it up to my community and your responses poured in. Now, some of your questions were pretty typical and some really made me pause. So today, I'm going to answer as many of your questions as I can, but I also want to make sure that you have a complete resource that you can turn to anytime. My first trimester survival guide is like having me in your back pocket for those first 12 weeks, covering everything from the questions we're answering today to the ones that you'll have at 2 a.m. next week. So download it free using the link in the video description right now, because pregnancy questions don't always wait for a convenient time. If you are new here, my name is Diana. I'm a physician assistant specialized in women's health and gynecology. Here on this channel, we talk about pregnancy, women's health, babies, and also being a mommy. So subscribe. And by the way, let me know in the comments section if you are pregnant now, and if so, how far along you are. But without any further ado, let's get into question number 1. Why does the baby fever completely disappear during the first trimester for some women? So the first thought that comes to my mind is that although this doesn't happen to everyone, this is actually more common than you might think. And it's usually due to a mix of hormones and then physical and emotional adjustment. So early pregnancy can trigger a flood of hormones like progesterone and HCG, which can make you feel emotionally disconnected or even disinterested in all things baby. Now this, coupled with dealing with the first trimester symptoms like feeling tired all the time and morning sickness, can lead to this phenomenon, sometimes called the baby blues of pregnancy, and it can feel unsettling, but it often gets better in the second trimester as the hormone levels stabilize, you start to feel better physically, and you begin to bond with your growing baby. Question 2, can you talk about the benefits of having a support system in the know and how that could be a huge benefit even if you were to have a miscarriage? So I think that having a support system can be a huge comfort to you no matter what. If the pregnancy progresses well, they can be there to help you with the first trimester challenges. And if you happen to have a miscarriage, it means that you have loving people around you who can offer you emotional support. This also reduces the isolation that many women can feel during a miscarriage. Question 3, what are the signs and symptoms of miscarriage and how do you physically and emotionally recover from miscarriages? So common signs include heavy bleeding, cramping, a sudden loss of pregnancy symptoms, and sometimes the passing of tissue. So if you think you're having a miscarriage, call your medical provider. Your provider might let the miscarriage pass naturally. They may offer you medications to help the uterus empty, or they might recommend a minor surgical procedure called a DNC, or dilation and curettage. Recovering physically can really be different depending on how far along you were when you miscarried, but in general, it's normal to have light bleeding or spotting for 1 to 2 weeks afterwards. Your period might return around 4 to 6 weeks, and it might be irregular for a while. Talk to your OB about anything specifically that you need to do. Most OBs would say to have vaginal rest, which means no tampons or sex until bleeding stops. I'm really glad that you asked about recovering emotionally, because I think that that's just as important as recovering physically. It is okay to grieve. It's normal to grieve because you have suffered a loss. Many women find comfort in talking to other people who have gone through the same thing. It is okay to talk to a counselor if you feel like you need to. Next question. Can you talk about shortness of breath and nasal congestion during pregnancy? That's kind of 2 questions because they're really 2 different issues and 2 different causes. So nasal congestion and runny nose is from the pregnancy hormones. They cause your blood vessels to relax, leading to more blood in the area, and that causes congestion. Now with shortness of breath, as your uterus gets bigger, it can put pressure on your lungs and your diaphragm. Your lungs don't have as much room to expand, making it harder to take a full breath, which means you feel short of breath. But shortness of breath can also be a symptom of something very serious called a pulmonary embolism, which is a blood clot in your lungs. Now, often you have other symptoms with the shortness of breath, symptoms like sweating, racing pulse, chest pain, or swelling on just one leg. And these symptoms definitely need to be checked out by your medical provider or in the emergency room. Next question, can you talk about the difference between morning sickness and hyperemesis gravidarum? Now, I've talked a lot about this in several of my videos. I will link to one of them right here. But morning sickness is nausea and occasional vomiting, usually in the first trimester, but sometimes can spill over into the second trimester or longer. Hyperemesis gravidarum is is much more severe, where you can't keep foods down at all. You can't keep liquids down. You can lose weight and get dehydrated. Now, this often requires medical intervention for dehydration and weight loss. So make sure that your OB or your midwife knows what's going on. Do you have any tips for working a demanding full-time job while dealing with morning sickness? Yes, I've done this myself, and I've also counseled my patients on how to manage this. It can be especially challenging, but there are a few strategies that I used and that I would tell my patients that really can help. First, keep small snacks on hand to prevent low blood sugar, which can trigger nausea. So I kept granola bars and saltine crackers around. Ginger also can help, peppermint tea, and acupressure wristbands. Those can also be really effective. Staying hydrated is really important, but make sure to avoid drinking too much all at once because a full stomach can also worsen nausea. Instead, sip small sips throughout the day. Now, if possible, try to adjust your work schedule to include more breaks. If you are particularly sensitive to smells, if smells are triggering your morning sickness, use a fan or air purifier to help avoid those strong odors. And if possible, consider asking your employer about remote work options if your symptoms are really severe. Now, if your nausea is unmanageable, talk to your healthcare provider about medications that you can take. There are prescription medications and then also over-the-counter options that can help you. Can you talk about the spotting you can have sometimes in the first trimester? Yes, spotting in early pregnancy is fairly common and often not a cause for alarm. About 20% of women can experience spotting early in pregnancy, and it can be due to implantation bleeding, cervical irritation, especially after sex or pelvic exam, or just increased blood flow to the cervix, which makes it bleed more easily. However, heavy bleeding, intense cramping or pain, or passing of large clots could be a sign of a miscarriage or ectopic pregnancy, which requires immediate medical attention. So make sure to reach out to your healthcare provider if you have any concerns at all. They might recommend an ultrasound or a blood test to check for a healthy pregnancy. How can you avoid losing hair and teeth during pregnancy? Pregnancy can sometimes lead to dental issues due to the hormonal changes, mineral deficiencies, and increased blood volume. So to prevent this, make sure you're taking a high-quality prenatal vitamin with enough calcium, biotin, and vitamin D, and then also make sure to maintain good oral hygiene, including regular dental checkups. Don't skip your dental checkups just because you're pregnant. It's safe to have checkups and even minor dental procedures. Just make sure that your dentist knows that you're pregnant. Now, regarding hair loss, generally speaking, the increased estrogen during pregnancy extends the growth phase of your hair cycle, which means you lose less hair, your hair grows thicker and fuller, and you might notice faster hair growth. But there are a few circumstances where you might notice more hair loss during pregnancy. Things like nutritional deficiency, severe morning sickness or hyperemesis gravidarum, stress, thyroid issues, and genetic factors. Most of the time, women will end up having the hair loss after pregnancy when the hormones go back to normal, and then you start shedding the hair that you would have shed during pregnancy all at once during the postpartum phase. That's a fun time. I'm just kidding. That's not a fun time. That's a horrible time. I hated the hair loss for postpartum. Now, I did actually make a video about postpartum hair loss, which I will link to in the video description, which you can check out when you are done watching this video. Can you talk about constipation during the first trimester? Constipation is a really common pregnancy symptom. It's often caused by increased progesterone, which relaxes the smooth muscle of your digestive tract. What that does is it slows the movement of food, and this can be made worse by iron supplements, which are often in your prenatals. Now, 3 things that I usually tell my patients is, number 1, drink plenty of water. Number 2, increase your fiber intake. I'd say aim for 25 to 30 grams of fiber per day. And an easy way to get more fiber are from fruits and vegetables and whole grains. And then number 3, engage in regular physical activity like walking or prenatal yoga. If constipation becomes severe, talk to your provider about using a stool softener or fiber supplements, but avoid stimulant laxatives unless your OB specifically recommends that for you. Next question, what should you do if you want to walk or move around during labor, but your doctor prefers you on your back? Now, it's your right to choose a birthing position that feels comfortable for you. Movement during labor can help with pain management and it potentially shorten labor. Now, things like walking, squatting, using a birthing ball, or getting on your hands and knees can all encourage optimal fetal positioning and reduce pressure on your lower back. before you go into labor, discuss your preferences with your OB. Let them know what you would like to see happen during your delivery. And assuming that everything runs smoothly during your delivery, you most likely will get to do just that. But even if you have a preferred birthing position, your OB may need to guide you to deliver on your back if it's the safest option for you and your baby. So that's all the time that I have today to answer your questions. If I didn't get to your question, or if you're new here and you have questions that you'd like me to answer, put that in the comment section below. We can certainly do part 2, part 3, as many as we need to do to get to all of your questions. Again, remember to subscribe, and then make sure to grab your free first trimester survival guide in the video description as well. Even if you are past your first trimester, there's so much good information in this survival guide. So make sure to grab yours today. Thanks for watching. If this is your first time to my channel, I've made a pregnancy series where I walk you through pregnancy week by week. Each video corresponds to a week of your pregnancy. So I'm going to link to that pregnancy series right here. Click on that and I will see you over there.